Greetings, friends, and thank you very kindly for joining us for our third MCC webinar, COVID-19 Hits the Developing World. This is an opportunity for you to meet and have conversation with Paul Shetler Fast, our Global Health Coordinator. And it's a behind-the-scenes look at MCC's work. We have people joining us via Zoom and via Facebook Live from multiple countries, so we are really glad to have you with us. And thanks for your ongoing support for MCC, your interest in our work. We're thrilled that you're part of the MCC story, and we're honored that you've chosen to join us so we can take this unique opportunity to give you a view of the way that we serve in the name of Christ. My name is Rick Kober-Bauman, and I serve as MCC Canada's Executive Director, and today I will be your host. I'm coming to you from the upstairs of our farmhouse near the little hamlet of Shakespeare, Ontario, and I am very happy that I have the gift of my dear friend and board member, Cindy Clausen, who is the hand maker of fine bow ties, and a little help from YouTube to actually get it tied. So some logistics. On Zoom, participants will be kept muted throughout the webinar, and if you'd like to submit a question, and we really hope you do, via Zoom, use that Q&A function. You can find it in that black bar at the bottom of your screen when you move your mouse. And if you've joined via Facebook, we also want you to encourage you to submit questions and use the Facebook comments section, and someone will be monitoring those comments and feed those questions to us. You can send your questions in at any time. We will give Paul a good portion, probably about 20 minutes to present, and then we'll have some good question and answer conversation with Paul for the last half hour or so of our time together. We'll try to get to as many of your questions as we can, and maybe yours will be a little bit like a neighbor's, and we'll hopefully get answers to most of them. We are also recording, and that will be made public very shortly after the live presentation. So a little bit about our topic tonight. COVID-19 hits the developing world. Here in the US and Canada, we've been living with the realities of COVID-19, the pandemic, for about 3 months. So we're accustomed to distancing, and we understand something about economic downturns and health concerns, and certainly interruptions to supply chains and many parts of our lives. However, as things start to open up here in North America, the coronavirus is moving from the global north to the global south. And of course, people in many cases there are already vulnerable to disease, to hunger. In many areas, the kind of isolation and distancing that we've practiced simply isn't possible. Water may not be as plentiful, meaning people don't have opportunity to wash their hands in the way we've been instructed to. And healthcare systems, they simply often aren't as robust, may not have access to ventilators. So what does that mean for MCC partners and for communities around the world? Today, we'll hear from MCC Health Coordinator Paul Shetler Fast. He's going to help us understand what the arrival of COVID-19 looks like for our global neighbors who are already living in considerably vulnerable situations. As I said, he'll present for about 20 minutes, and then we'll have some conversation after that. So who is Paul? Paul, our Global Health Coordinator for MCC. He oversees health work around the world and has been a very valuable resource to MCC, especially in these last months while we've been responding to the current COVID-19 pandemic. Now, some of you may also feel like you've heard from Paul before because he has been the voice in our May appeal. And so if you've come expecting more good information from Paul, you have certainly come to the right place. He and Rebecca, his spouse, make their home in Goshen, Indiana. And they have 2 children, Madeline and Gideon. And they served as representatives for about 5 years in Haiti with Mennonite Central Committee as well. So Paul, we are very grateful to have you with us this evening and invite you to lead us in the next steps of our webinar tonight. Welcome, Paul.
Thank you. Thank you very much, Rick. Greetings, everyone. As Rick said, my name is Paul Shetler Fast, and I just really appreciate you all taking the time to be with us today and to talk through some of these important issues. So hopefully everyone can see my screen. And I'll be talking through MCC's health response to COVID-19 and what this means around the world. As Rick said, my name is Paul Shetler Fast. I'm MCC's Global Health Coordinator. Calling in from Goshen, my wife Rebecca is currently putting our 2 children to bed. We moved here just this last spring from our time in Haiti. And a special greetings this evening to my family in Ontario, my wife's family, who is calling in, I know. So today I'd like to share about the COVID-19 pandemic, its impact on the people we work with around the world, and MCC's response globally in this time of crisis. But the 3 main takeaways that I hope you come away with from this presentation are these key points. Number 1, MCC was founded for times like this. This is what we exist for. We are well positioned to do this kind of work, and we are responding alongside our partners in the places that need it most. 2, encouraging all of us to remember to think about the faces, the individual stories behind the headlines and the statistics. And this can be hard in our media and political climate, but I think we're called to look deeper than those headlines and those top-level numbers and remember the real people, the individuals impacted, and our connections with them. And then finally, connected to this, we're all in this together. Around the world, despite our vastly different circumstances, the pandemic is a good reminder of our interconnections, and it's a chance to lean in with empathy to what is happening across the street and around the world. So our first point, MCC was created for times like this. We were founded in a time of war, of famine, and pandemic. In 1920, 100 years ago, when MCC was founded, the world was just coming out of a world war. The Russian Revolution and accompanying famines and violence were ongoing and made up one of our first areas we engaged. And the devastating influenza pandemic of 1918, often called the Spanish flu, was just winding down after taking an estimated 50 million lives. MCC was created to respond to this crisis and suffering. Initially, the response in 1920 was that broadly focused on humanitarian relief. And the picture you see here is of a feeding center in 1922, part of that larger relief effort working in what is now Ukraine and Russia. And while we're not a medical organization per se, health has always been a key part of our work. Those first activities included the provision of medical supplies and equipment, of nutrition supplements for the most vulnerable, things like the feeding centers you see there, and medical staff were actually among some of our first international employees. MCC as an organization was built to bring people together to respond to these kinds of complex needs in crisis. And those critical needs remain. War and displacement remain a major driver of instability around the world. A record 71 million people right now are displaced due to violent conflict. And those conflicts complicate any of our relief efforts. A growing food crisis is happening around the world. An estimated 265 million people are in acute food insecurity right now, and that number is expected to double due to the COVID pandemic. Sorry. And then we have the pandemic itself. According to the latest WHO, World Health Organization data today, there are confirmed 7.9 million cases and 435,000 confirmed deaths. And a reminder that as the crisis spreads to the global south, those numbers are increasingly an underestimate due to the low testing rates and data collection systems in poorer countries. In many ways, these times we are living through are unprecedented. We are seeing records of suffering and disruption being broken. But in other ways, these dynamics are reminders of past periods and the unique role that an organization like MCC can play in responding effectively and connecting communities in times of crisis. The photo here is of a staff member of one of our partners in Tyre, Lebanon, responding to the overlapping crises happening there. People displaced by war in Syria, facing a food crisis as the economy collapses. And now, how do we respond safely to those existing needs in a time of pandemic and help people take the basic prevention measures to keep themselves and their families safe? The reality of the COVID-19 pandemic is that while its first phases were in relatively wealthy countries, places like China and South Korea, then Europe and North America, increasingly the places the pandemic is growing most quickly are in the countries least able to respond. Poorer countries in the global South, where MCC's work is concentrated. But this story is often hidden in the news, partially because most of our news focuses on us and people like us, and partially because testing and data are relatively weak in the poorest areas. So the headlines numbers rarely reflect that full reality. So it's more important than ever to go beneath those headlines and the statistics and put faces to what we're really talking about. And to that effort, I'd like to introduce you to Bernard, the man you see pictured here. He's a 67-year-old man, and I met him for the first time about 2 years ago, living in a densely packed urban settlement in Bujumbura, Burundi. He's HIV positive and has other health complications. He's a widower, and he is the sole breadwinner for 6 children who now live in his household. As an immunocompromised older man with additional health complications, in a country with extremely limited medical capacity, he is among the most at-risk people anywhere. His lifeline right now is a small clinic run by MCC partner WOI, several blocks from his house. And through that project, he's still able to safely get the medical care, medicines, and nutritional supports he needs to keep himself and his family safe. The project has had to make adaptations for COVID-19, things like extra protective equipment for staff, new ways of queuing patients to reduce crowding, proactive outreach to the community to help families take the simple prevention measures they can to reduce risk, all essential steps to make sure people like Bernard can stay safe. And that prevention is absolutely key. We know these countries and their medical systems are not prepared to handle disease on this scale. As just one example of that, I have here for you to see a map of ICU bed availability around the world. And the details, I know it's small, are not important. It's the pattern. There are simply not enough high-end medical resources in the global South to deal with this as a medical crisis with medical solutions. 41 African countries share fewer than 2,000 ventilators. That is less than the city of Toronto between 41 countries. There is no plan B for much of the world. There are no ICU beds and ventilators for most people in poorer countries. According to the latest WHO data, there are no ICU beds in Burundi that meet minimum standards for treatment of COVID-19. There's no plan B for people like Bernard and the 6 children who count on him. Prevention is absolutely critical. And as with Bernard in Burundi, I think of Louise and her daughter Wilda in Dégravé, Haiti. When we lived in Haiti for 5 years, I got to know people like Louise well and the struggles they face to make ends meet. Those struggles are immense at the best of times, to stay healthy, to access school for their kids, to keep food on the table. Now, last year, Louise's children made nearly miraculous recoveries through a community child malnutrition program MCC supports. When I first met the kids at nearly age 2, neither child could talk or walk. Their hair was weak and brittle. Their mother, unable to access the health care they needed, had given their fate over to God. But with the help of dedicated local community nurses in our project, Louise was able to bring her children back to health, and it was amazing to watch. But the COVID-19 pandemic is hitting the most vulnerable hardest and making life for people like Louise and her children even more precarious. The markets where Louise earned her living have largely been shut down. The pharmacy she used to buy essential medicines in hasn't been able to restock. The nearest hospital has canceled everything it deems to be non-essential services. COVID-19 is widening existing inequalities at a global scale within nations and within communities. Here in the US and Canada, Indigenous communities and communities of color have been disproportionately impacted, both with higher mortality rates, some up to 3 times higher than their white neighbors, and with higher economic costs, making up a higher percentage of the unemployed and those least likely to be re-employed. In the global South, it is the poorest households who are least able to practice basic prevention measures, things like hand washing or physical distancing. They are some of the most impacted by lockdowns and trade restrictions, falling remittances, and the like. People like Luis have little market power to access scarce health resources when fragile health systems are overwhelmed, or when resources are diverted to fighting COVID-19, or when non-essential health services that they depend on are canceled or delayed. The good news, communities are mobilizing, and we are there on the ground partnering with them in this work. Every project and every community we work in has been impacted. Every project and every partner is adapting to the new realities, and communities are mobilizing to save lives and keep essential services going. Just one beautiful example of this work is with the Kenya Mennonite Church and our maternal and child health project with them in the urban settlement of Mathare, Nairobi. This community is the definition of the perfect storm for the COVID-19 pandemic. Houses are densely packed and families rely on day labor to put food on the table. Physical distancing is a luxury they do not have. Clean water is scarce, basic sanitation is not available, and health services are inadequate. If COVID-19 were to get going in this kind of community, the results would be devastating. And that is why we and our partners responded proactively. Before the first case of COVID got to Kenya, the director of the project, Judith Siambe, who's pictured there on the far right, was on the phone with us to figure out what we could do to save lives and reduce the likelihood that COVID-19 could get a foothold in her community. We took simple steps, redesigning project activities to reduce face-to-face contacts, ensuring staff and volunteers had the personal protective equipment they needed to do their job safely, setting up 50 free hand washing stations around the community, and providing practical, localized prevention advice that families could actually do within their context to reduce risk and stay safe. By being way ahead of the curve in most of the places where we work, our partners were able to adapt effectively, get what they needed, and keep people safe. This process of local partnership, community mobilization, and adaptation is happening all around the world in every project we support. Now, in some cases, I think these adaptations are ones we may want to keep around even after this is done. Here is a community health worker training on COVID-19 prevention strategies happening in Odisha state of India. In the past, these kinds of trainings would have happened inside a pretty cramped office generally. And I think we may want to lobby that all staff meetings should happen in such beautiful outdoor locations. Similarly, we're learning how to do our work more effectively with limited travel and the need for rapid adaptation and being nimble and responsive to shifting local priorities and local realities. Some of the learnings will and should stick with us long after this pandemic is controlled. Now, a huge part of our COVID response is directed at supporting and protecting the frontline staff who are doing essential life-saving work around the world. The dedicated volunteers and staff of our partner organizations are on the front line of this pandemic. The work they are doing is life-saving, and it is more important than ever. They want to keep working, and keeping them safe is our #1 priority. One example of these heroic staff are nurses, Furaha on the left and Charlotte on the right, standing in the doorway of the small clinic that MCC supports with partner ECC Meru in the Mubimbi internally displaced persons camp in eastern DR Congo. And by the way, this picture was taken prior to the pandemic. That is why they're not wearing masks at the moment. And this clinic, like others that MCC supports, are on the front lines of the pandemic in places where their work is absolutely critical. With your support, nurses like Furaha and Charlotte and the volunteer doctors they work with now have the basic protective equipment that they need to continue serving the nearly 5,000 patients who depend on them. They want to keep working. They feel called to this work now more than ever, but they do need basic things like soap and masks, gloves and goggles, disinfectant to be able to do that job safely. And I could tell similar stories from around the world. In Macha, Zambia, we've been able to get the personal protective equipment to the 375 doctors, nurses, and other staff at the Brethren in Christ Hospital there, which is the sole hospital for a catchment area of over 160,000 people. This proactive preventive work means these vital services can remain open when they are needed now more than ever, and the staff can remain safe and they can go home to their families each evening. A 50-cent mask has never been such a strong sign of solidarity with our brothers and sisters like Furaha and Charlotte working on the front lines. Basic prevention can save lives, and I am so grateful for how quickly MCC was able to respond and the generosity that has sustained this work as the pandemic continues to grow. Nearly 90,000 hygiene kits are being deployed around the world, some packed here in North America and shipped, and others put together on site with locally purchased supplies. These kits are a vital tool to allow the most vulnerable families to practice the prevention measures like hand washing that so many of us can take for granted. And in other countries like Chad and Egypt and Nicaragua, we are working to ensure basic hand washing facilities and access to clean water. And all around the world, our staff and partners are providing the basic prevention education that can help families stay safe. We have COVID-19 specific work happening in 38 countries, and all of this work saves lives. Which brings me to my last point, our call during this time of crisis to support one another. These are difficult times. We are all in this together. Of course, in different ways at different times. I learned a lot in Haiti during our 5 years there, and part of that was a deeper understanding of solidarity during times of pain and uncertainty. In Haiti, there's a proverb that says, "The rock in the stream does not know the pain of the rock in the sun." That means is that despite our common humanity, it can be difficult to understand another's suffering. We do not walk in their shoes. In fact, that is probably the biggest barrier to communicating about global health. How do you share what this work means when our contexts and our realities are so different? The rock in the stream does not know the pain of the rock in the sun. But I come back to the reflection of a friend and a priest I met in Haiti who explained how he had guided his congregation through times of suffering, and particularly the 2010 earthquake in Haiti, which impacted everyone in the country, but in different ways. Some had lost loved ones, others acquaintances. Some were overwhelmed with joy at avoiding the worst of that pain, while others were crushed with personal loss or guilt of having been spared when others were not. And his favorite verse, the one I put up here, is from Romans 12:15. And it's coming in a section that tells us how we should act as the church, and that we should rejoice with those who are rejoicing and weep with those who are weeping, to recognize our shared humanity and shared connection, and to stand in solidarity with one another, even when it is hard. I think this call to solidarity is part of why MCC was founded 100 years ago. It's why our mission and our health work remains more important than ever today in the midst of crisis. So thank you again so much for being part of MCC's work, for being part of this conversation, and I'll turn it back over to Rick.
Paul, thank you. Wow, what a rich 20 minutes. I've been making notes of things that you've said that we might want to make some connections to. One of our participants tonight has already said, you know, I think very much in keeping with one of your principles as you started out, Craig said, thank you for naming the people in your slides. So yeah, I want to add my gratitude to Paul, because I think he started by saying we want to get behind headlines and statistics and recognize that our sisters and brothers, our neighbors, who have various kinds of vulnerabilities, they may be in the sun when we are in the water. And so you did a great job of helping us see and connect with those neighbors of ours. Thank you. So we're eager to have questions from people, and thank you for those who have sent them. Paul, one of the questions is around what the curve. We've heard a lot about, flattening the curve. You made some very, I think, helpful and yet, somewhat scary prognosis here about what happens when communities are highly vulnerable. What might the curve look like in some of the settings that you talked about, where perhaps the prevention that you mentioned in Mathare in Kenya isn't happening or cannot happen?
Thanks, Rick. That is a great question. This is an incredibly difficult time for public health in these communities that don't have the resources that we have in North America. The things that we have taken to flatten the curve in wealthier countries around the world, things like lockdowns and virtual work, masks and hand washing, all these steps are just incredibly difficult for the poorest people. And for densely packed communities, whether those are urban informal settlements, sometimes called slums, or refugee camps, internally displaced people's camps. And if they are not able to practice prevention, then this disease will go unchecked in those communities, and it will burn through them very quickly, and the consequences will be devastating. The hope, and we have seen good evidence so far, is that good prevention can flatten that curve. Even simple prevention, things like we're doing in our projects, getting out there before the first case arrives and making sure people have masks and hand washing, they know how to protect themselves. It can help, every bit can help. It doesn't have the same, they don't have the same resources to bring to it that we do, and they don't have the same data. One of the things we've gotten used to in North America is very up-to-date information on test rates and hospitalization rates. In most of the places MCC works, there's very little data, and that data is very incomplete. So in most of the countries that we work in, it'll show almost all the cases exist in the capital city. Well, that's just because that's where the labs are. And so it's difficult to project exactly how those curves are happening. The hope is that we can slow them down enough to save a lot of lives.
Thank you, Paul. A food question has come in here. You talked a little bit about this. As people are prevented from going about their daily activities, generating income so they can buy food, is MCC involved in helping with food security, food availability for communities like that?
Absolutely. So it is essential. The food crisis that existed prior to the pandemic and the food insecurity in these communities is getting worse. When poorer countries have attempted lockdown, they do not have the social safety net we have. And people do not have savings, in many cases, don't have access to any sort of financial institutions for that kind of cushion. And so part of when I talked about realistic advice is the kind of advice that people can actually take, acknowledging that many of them do have to go out into the community to earn their daily bread. And so how do we do our programming in a way that is realistic to their setting? And MCC is doing a lot to respond to basic food needs. And we have major food distribution programs going on in countries around the world, places like Malawi and Syria and Chad, Lebanon, places where people are at this incredible state of vulnerability, and it is made worse by this. And so our challenge is not only to ensure that there's food availability, but it's delivered in a way that is safe and is realistic for them to be able to access.
You mentioned Syria, Paul. I have my own memories of being there a few years ago. Things were still very unstable, and you also started your talk with some mention of MCC's beginning: pandemic, war, violence. So health responses and being in the presence of violent disruptions. Can you say a bit more about how health and peace are both parts of core work for MCC? You know, you mentioned it in our beginnings, and you're talking about it today, 100 years later. Why are those both themes that are important to MCC?
Absolutely. So these are deeply interconnected. We like to say in public health that disease does not exist outside its social context. The vulnerabilities that people bring into the pandemic largely determine the outcome, the risks that they face. And war is a risk on many of those levels in terms of displacement, the lack of supply chains that are stable, lack of economic opportunities, in addition to the violence itself. Where these points come together is where that need is often greatest, and places like Syria are examples of that. Places like the Democratic Republic of Congo that I talked about, that displaced people's camp, that would be another example. And if we're going to be successful in approaching any of these issues, we have to recognize people's holistic situation, the many risk factors they face, and then help them address those in a way that that is responsive to a conflict, to a context that is always shifting, to conflicts, to other vulnerabilities that they have.
Well, here's another food-related question. It's not unlike what you talked about before, but I think this is less about MCC. But from your knowledge of communities that are in lockdown, how are people getting food?
So the reality is that people will do what they need to do to keep themselves and their families alive, and food is a part of that. Now, there is evidence from across the world of the poorest households going down to a meal a day or less. So people are stretching what they can, but that can only go so far. And so people are relying on what resources they have, their social networks. We have seen around the world people in cities fleeing to the countryside to get closer to family members who might have subsistence farms or other sort of agricultural resources they can rely upon. They're drawing on those social networks as they're able, and they're out in the street, not only putting themselves at risk to COVID-19, but in many cases, we've seen police brutality, we've seen police crackdowns, which have only made those situations worse.
Well, I want to pause again and invite people to continue to send their questions in, whether you're listening in on Facebook Live or you're on Zoom. We're eager to hear from you. This is your chance to ask a question of MCC's Global Health Coordinator and be part of the conversation here tonight. Paul, before you came into this role, you and Rebecca and your family had a number of years serving in Haiti, a community that, a set of communities that certainly is not a stranger to vulnerability. You talked about the earthquake in 2010. What lessons come with you from those years that are helpful either now, specifically in the pandemic, or in your health work more generally?
That is a great question. And there's a few sort of tiers of learnings that I take from Haiti. One is this concept, if people are familiar with Paul Farmer and Partners in Health, which is an MCC partner in Haiti, and he talks a lot about, within the Haitian context, the concept of acute on top of chronic crisis. So that, we think about this in health, that it's why it's different if an 80-year-old coming out of surgery gets in a car accident versus a healthy 20-year-old. Those chronic issues that people have are going to impact how they're able to, their resiliency and their ability to bounce back after a crisis. And Haiti is a context where you have chronic instability, chronic poverty, political misfunction, and environmental degradation. And then you have these acute crises on top of it. And that same dynamic is a lot of what we're seeing with this COVID-19 pandemic. That's why we're seeing, mortality rates in African-American communities in the United States being way higher than their white neighbors. And that's because of this chronic systemic problems that exist in this country, and those sorts of issues around the world that make people vulnerable to these shocks. And so Haiti just drove that point home deeply, being there for 5 years. Another big learning from Haiti was to have humility as outsiders as we come into particularly crisis situations. People are resilient, people are resourceful, and we should be building on that resilience and leaning into their strategies, their spirit, their initiative. We will find more success. And in a crisis, in public health crises, there is often a temptation to say, well, this is a biological thing. There's going to be one biological solution. This is the perfect chance for a top-down solution. And it's just wrong. It doesn't work that way. So if we look at Ebola in West Africa several years ago, or in Congo, which is just re-inflamed, when you come into communities in crisis with outside solutions, assuming that it is an expert-driven outside intervention that is going to be the key, that often backfires, not only wasting untold resources, but also creating community hostility. And that's where an organization like MCC is really well positioned with our local partners. So we're not coming in with all the answers and pre-baked solutions and here's what your needs are and how we're going to spend resources, but really working with the community to sort of find that point where we can work together to create meaningful change. And what Haiti drove home for me, Haiti has thousands of organizations working there from North America, and much of the work that happens there is ineffective. And a lot of the reason it is ineffective is because it is not engaging communities at their point of resilience and their spirit and their initiative and walking alongside them. It's coming in with this outside perspective. And this is another, I think, a good example of what we should be learning in this kind of a crisis, that all the good things we know about why localized work and leaning on local partners is the most important, that is not negated in a crisis. That is not less important in a crisis. It is more important. And so I bring that lens to this.
Yeah, I really like, Paul, that you are in all of the way you just talked about your experience in Haiti, very highly focused on community resilience, dignity of local solutions, and the absolutely critical element of partnership that I think MCC has learned over its century. So really glad that you bring that into your health work, Paul. And I should have properly footnoted that question. Your dear friend, Bob Nally from Waterloo, Ontario, sent that question in. So shout out to Brother Bob. Hey, I have another one. This is from Eugene. How aware of the crisis and the risks are people in the most rural areas?
Great question. So this ties me back to my last answer about when people come in with an external voice. So in communities across the world, rural communities, they have heard that this is coming on the radio, on the TV if they have access to that. But generally that message has come from the Ministry of Health or a WHO expert on the radio. And that is not a perspective that necessarily has a lot of weight in rural communities who did not see the government and the WHO as caring about them generally, being connected to their health and well-being. So for example, I was talking to our partner in Kasai in Democratic Republic of Congo, where our project has very specifically said, we need to do this through the church. The church, those pastors are trusted voices on the ground. And we believe that they are going to be more influential, be more listened to than a radio broadcast coming out of the Ministry of Health in Kinshasa. And that has proven to be the case. So we're hearing story after story of people saying, yeah, I heard it. I heard a radio story about that, but I thought it was just for European disease, or I thought it was just a disease for rich people. I didn't think it had anything to do with me. But when I saw that my pastor was willing to shut down the church, which meant that there'd be no offering, which means he's not getting any salary, and that the pastor was willing to do that and spend his time instead with a megaphone going down the little alleys of this community saying, guys, we got to be careful. We got to look out for each other. We got to protect each other. It was that local voice that meant more than anything I could say, than the Minister of Health could say, the WHO pronouncement, than celebrities on YouTube. Like, that is the driver of behavioral change, is local. And that's where I think MCC really is well positioned to do this for exactly the reasons that that question talks about.
That's an amazing story of and an illustration of localization and again, as you say, quite close to the core of how MCC chooses to work. Hey, what is the best way for people to support MCC's COVID-19 relief efforts internationally?
That is a great question. We need all the help we can get. Everyone is part of this. Like I said, we're all in this together. I'd encourage people to go to mcc.org or mcccanada.ca and give. Support our health work, support our COVID-19 response work. You can designate health if you want to, or where needed most. That support is essential at this kind of a time when we need to be ramping up our response. The other thing I'd say is this is a time when we need to remember our brothers and sisters abroad. When the news is focusing on the crisis of the hour, the political drama of the hour, when it starts to recede in our hometowns, to remember that it is only ramping up in places that the news will never cover. And so your prayers, your support, your advocacy that these issues matter, it makes a difference. It's part of us all coming together, remembering that we really are in this together, even if we don't hear those stories on the news.
Yeah, Paul, we all know we've heard the "we're in it together" expression a lot over the last few months, but I appreciated the way you've used it tonight, that it really is an all, and that there are a lot of ways that we show that. We show solidarity with each other. You talked about the hygiene kits that have been shared around the world. I think you said like 90,000 of them.
Yep.
And I think there's special ones now that have a disinfectant that's specifically included for these times with COVID. Yes, we invite people to pray for their neighbors. It's amazing how much we've felt the vulnerability, and yet, as we think about what it means to be all in this together, there's such a broadened sense of who our neighbor is. And of course, as Paul said tonight, you've all heard that the need is considerable, and we of course are grateful for the very generous donations that have come into MCC. We invite others who are looking for an opportunity to respond to the kinds of vulnerabilities that Paul's talked about. Please go to our MCC Canada website. There are opportunities there for you to, as Paul said, to give a where needed most gift, or to direct your gift to the COVID responses specifically. We also have an MCC US website, depending where you're listening from. So please consider being part of this response, and thank you for the many ways you're already part of this engagement. So we continue to have a few more minutes left here if there are other questions. Paul, one of the things that we talked about before we started tonight, and I've heard you say this in the past, we can have hazards like COVID that produce a disaster, but it's really only when there are pre-existing vulnerabilities. And I loved your story about prevention with Judith, who's the leader of this project in an informal settlement, Mathare in Kenya. Can you say a bit more about how vulnerability and prevention become key places for MCC to engage around COVID?
Absolutely. So the best simple illustration that I can give of this dynamic around vulnerability and risk and its connection to hazard or sort of natural conditions is for people to just have in their mind's eye Haiti and New Zealand. Those two islands have roughly the same natural risk to natural disasters. And yet the reality of what natural disasters mean in those contexts is just vastly different. The same earthquake in New Zealand will lead to probably no deaths, maybe dozens, and in Haiti would lead to thousands, tens of thousands. The vulnerabilities that exist magnify any natural risk or any of this natural hazard that exists. And so as MCC as an organization, one of the things that makes us unique is we have deep long-term relationships in the places that we work. And so we can understand this vulnerability at a deeper level in the vulnerability and the resilience of the community in a deep enough way that we can do effective response with the community. And so I think of my time in Haiti with cholera, where cholera had been raging in Haiti for almost 10 years. It had been largely unchecked despite millions of dollars being spent. And the way that we were able to stop it with relatively small projects in the communities we worked in is by taking that deep dive with the community on what are their specific vulnerabilities and their specific resiliences, and then designing projects that meet the community where their targeted needs are, and letting them be the lead on addressing those vulnerabilities in a systemic way. And so MCC is really well positioned to do this kind of work that is looking beyond the crisis, that is looking, that has that historical knowledge and those relationships and the national staff and the local partners to understand the roots of that vulnerability and that risk, and develop solutions that are not just band-aids over it, that are not just handing out masks or doing public service announcements, but are trying to address some of these deeper issues of that are driving the vulnerability in these communities.
The Haiti, New Zealand comparison and contrast is really helpful, Paul. Thank you. Hey, we're getting close to the end of our time here. I think we're going to end with one last question that's come in. It's kind of a personal one, Paul. I don't think you're going to pass on it, but someone has said, Paul, what gives you hope? In the midst of your work, in the midst of what you've seen and faced, why does Paul Shetler Fast have hope?
So if what we do is watch the news, I think it is extremely easy to lose hope. When we are simply watching this as a passive observer, seeing the devastation that's happening around the world. Similarly to if we're seeing, for those of us in the United States in particular, seeing the recent unrest and deeper wrestling with systemic racism and those sorts of issues. If we are simply sitting on the sidelines, I think it is very easy to become simply overwhelmed and depressed by that flood of news. What I've found, Haiti, for example, is a difficult context. The issues that we are working on with our partners there are incredibly deep and frustrating, and progress is slow and hard won. And yet, the closer you get to the ground, the closer you get to the individuals who are rebuilding their communities, the more you're working with the Judiths and the Furaha, that nurse in the DR Congo, the more you're working with these individuals and supporting their work, being part of making a difference, the more hope there is. So for me, I have the privilege of working with our staff and our partners around the world and getting to see the projects and getting to review the budgets and knowing where those dollars go and seeing the change that happens. But, you know, I guess for me, I would encourage all of us listening to do what we can, to join in where you can on these issues that are overwhelming. And the more that we can be part of the solution, there's hope because we can make a difference. And I think that's what we're called to do, is to do what we can, to make a difference where we can, and to find the hope in that.
Wow. Paul, your hope is infectious, if I may say so, if that's not a too bad choice of words tonight. It's really been a rich nearly an hour with you, Paul. You bring depth and experience and yeah, a lot of hope, a deep sense that we are not sidelined, we are not paralyzed. We have, with the support of the kinds of people that are part of this tonight, really an opportunity to share God's love and compassion for all. And I really appreciate the way you have opened up the all in a very real and meaningful way tonight. So, Paul, I want to thank Rebecca for getting Madeline and Gideon settled down tonight, and yeah, give them a hug from your colleagues. We really appreciate you taking this time to be with us. And for all of you who have joined us from wherever you are, we understand there were people from multiple continents tonight. Join us again. We have a new podcast called Relief Development and Podcast, and it's available wherever you get your podcasts. This month, we're going to be talking to Olympic gold medalist speed skater Cindy Clausen and hearing about MCC's work in DR Congo from a staff member, one of our colleagues who was once displaced himself. And of course, this webinar series, you were part of number 3 tonight. There's another one coming on July the 15th. We'll be looking at the links between a health crisis and food shortages. Paul hinted at some of those things tonight, but do come back again. That webinar will feature some of our colleagues from South Sudan and Southern Africa. And you've probably heard the World Food Program and the UN is predicting this may be the worst food crisis that we've seen in 50 years. And we want to explore that and I think also bring, again, some messages of hope. So for your attention, your questions, your commitments, your prayers, and your participation tonight, we are deeply grateful, and we invite you to continue to stay involved with MCC and share God's love and compassion for all in the name of Christ. Thank you again for joining us. See you next time.
Thank you all.